Getting fit is no easy task, but it is crucial for your health. It's also crucial for companies that are subsidizing your health care costs. Joining us right now with more on that is Dr. Toby Cosgrove. He spent decades running the Cleveland Clinic, and he's now joined Google as an advisor to their cloud healthcare system. And Dr. Cosgrove, thank you so much for being here today.
Nice to be here, Becky.
I mean, this is the time of year where we all start thinking about being healthier. It's really hard to stick to it, too, though.
It's really hard to stick to it, but, you know, I think one of the important things is you have a buddy to do it with, and maybe this mirror is the buddy that you do it with.
If you have no friends, at least you have the mirror.
Yeah, and so you need to have a partner to do these things with, and you need to share back and forth between the two, and you need to set a reasonable goal.
Some companies are actually offering financial incentives for people to try and keep a healthy lifestyle. You did some stuff like that when you were at the Cleveland Clinic.
Absolutely, we did that and made an enormous difference. I mean, for example, we had changed the food. We gave people incentives to exercise. We gave them incentives to stay healthy if they had diabetes or hypertension or asthma or smoking or obesity. And we saw amazing results. Over the last several years, our inflation rate of our healthcare costs has been flat. It probably saved us over $600 million in costs for looking after our employees, and it reduced the costs for the employees for their copays for their health.
When you say keeping inflation flat in healthcare, that's a pretty big deal.
Our rate was going up at 7.5% a year 10 years ago.
Before you started making
Before we started this, and it made an enormous difference. I mean, the stopping smoking, they lost on an average of 5 pounds for all of our employees over that period of time, while the weight for the general public was going up. They were having 20% reduction in the sick days. And it was costing them less in terms of their insurance.
You're working at Google now. What kind of projects are you working on there?
As you look at healthcare, we have got a blessing and a curse in the fact that we have an explosion in the amount of knowledge there is in healthcare. For example, there are 5,800 medical journals that are turning out 800,000 articles a year. Who can keep track of all?
Basically Watson, that's about it.
Exactly. So there's this enormous amount of data, and the data is a problem for us to keep track of, and that's where I think the cloud is going to come in. And as the data goes to the cloud, all the major cloud providers have come to agreement that they will share de-identified information across the way. So we got interoperability.
You don't have to worry about privacy, but you can dig deeply through this information and try and find trends and ways to really solve some problems.
Right. So you got interoperability. So now you have huge data sets that you can begin to analyze, and now that's where AI and machine learning comes in to begin to help us.
What kind of things, like in your dream world, what kind of things could we resolve with this information?
Well, we begin to understand what the best treatment for things are. For example, if you are 50 years old and hypertensive and obese and so on, what's the right hypertensive medication for you? And it varies from person to person. If you got enough people with those characteristics, then you begin to predict that.
And you can find out which is working, which is not, and get subsets of each of that.
And we also think it'll cut down on the time for drug trials to be able to bring things to the market more rapidly.
That's really exciting.
It's very exciting. Very exciting things we can do.
So what types of technology in 2019, things that are being used by doctors, by hospitals, what kind of things are we starting to see, maybe even by people, like watches or things?
Well, I'm incredibly excited about the opportunities for telehealth. About 4 or 5 years ago, my daughter and I were out on the East Coast, and she gets a rash on her face, so I take a picture of it with my cell phone, send it to the dermatologist, and to make a long story short, it turns out to be poison ivy. And so think of what that saved us. It saved us a trip to the doctor's office, parking and going in and sitting in the waiting room, then going into the exam room, then turning around and coming, repeating all that. That's half a day at minimum.
Not to mention, it stops it from getting worse, so you can get the treatment you need, the right treatment right away, and saves you all the pain and agony of living through that for longer than you need to.
Exactly. And think about mental health. Whether the opportunity is there. It's an enormous opportunity. Kaiser is seeing over 50% of their patients distantly.